Today we are going to discuss about the most important general physical examination in clinical settings, that is the series of PICCLE: pallor, icterus, cyanosis, clubbing, lymphadenopathy and edema. So we'll deal one by one now. First of all, about pallor. So first we have to know what is pallor. Pallor is nothing but paleness or waxy appearance of skin and mucous membrane. So this is the meaning, and it is the clinical manifestation of many underlying diseases, most commonly anemia. So it is a clinical manifestation of diseases, most commonly anemia. So here important thing is both are not same. Pallor and anemia are not the same terminologies, because in some cases we might see a person appearing pale, completely pale, but there might not be loss of even a single drop of blood. For example, we'll say shock or hypothyroidism, Addison's disease, even Sheehan syndrome, even cardiovascular collapse. So these are some situations where person might appear pale, but there might not be anemia underlying. We have to remember this. Then, after understanding the terminology, where do we look for the pallor clinically? So sites are important. As we all know, most commonly we look for lower palpebral conjunctiva. So retract lower eyelids both at a time and look for the appearance of paleness. So this is the most common site. Other sites where we can see pallor are tongue, especially the tip and dorsum. Then even soft palate, even the nail beds. So nail beds, and we can look at palms and soles. So these are the sites where we can observe pallor. And some important points regarding pallor, that is, usually we'll say like whenever there is loss of crease over the palms, that is, even the creases are appearing similar to the other part of the palm. So it is the point where we can roughly guess that hemoglobin might be less than 7 gram per deciliter. So this is a sign by looking at palmar creases. And one more important thing is, when we look at the retina through fundoscopy, if the retina is appearing pale, that will suggest that roughly hemoglobin is less than 4 gram per deciliter. This is at retina. So these are some interesting points regarding pallor. And final important point about pallor is, we have observed few students commenting the grade of pallor. For example, they will tell that it is appearing as severe pallor, mild pallor, moderate pallor. So it is not ideal to grade pallor. It is all about anemia, which we can grade actually. For example, mild anemia, moderate anemia, severe anemia. These are all based on lab values of hemoglobin. So don't confuse this grading with pallor. So there is no grading in pallor. You just have to mention whether the appearance is pale or not. That's it.